Welcome to the Prepping Report. Today we're going to talk about essentials of medical preparedness. And the reason why I'm doing these videos is a lot of people get the beans, bullets, and band-aids. They get the band-aids portion all out of whack. When they think of medical preparedness, they think of having some type of field surgery kit. They think about all the pain meds they can get or how to get them, or antibiotics, which is totally wrong. Those items are the last thing on a prepper's list of needs. So in this portion of the prepping report, we're going to talk about part one is training. Where do you get medical training? First, we're going to start off with basic medical training. If you are not CPR certified, never done CPR before, that's the bare minimum start. Go to your local hospital or some type of community center. Even you can go to your police department or fire departments and ask, where can you get CPR/AED certified? Usually in your area there's going to be some type of American Heart Association or Red Cross certified trainer in that. They also may offer basic first aid skills. Go to them. Take some classes. That's your basic medical training that you can get. Also, basic medical training wise is some type of trauma training, tactical response, arm dynamics. Most firearms related training companies have some sort of medical training that you can go to wherever you're at in the country. I know tactical response is more in the southeast. Arm dynamics is up north, but most firearm trainings offer some type of trauma class. I highly recommend that you take that. Whether you are your prepper group's medic per se, everybody needs to have basic trauma training. If you carry a gun, you're most likely going to save somebody's life more than taking somebody's life. As a police officer, I've been a full-time police officer for 7 years. I've yet to have to take anybody's life, thank goodness, but there are people walking today on earth just because that I had some trauma training and I was able to help them before EMS or paramedics arrived. So there's also first responder courses. You can go to your local hospital, fire department. Wouldn't go to the police department for this, but go to them excuse me, and ask about the first responder course. You may have to pay some money for it, but it's a very good course. Usually you go one night a week for 6 weeks or maybe 9 weeks, and then you ride on an ambulance afterwards to get your certification. But first responder courses are also very good, along with trauma courses that are offered through most firearms companies. Then going more long term, the Patriot Nurse, I highly recommend you subscribing to her YouTube channel. The Patriot Nurse has her medical class that she goes around the country teaching. If you've not had any of her classes, I highly recommend going to it. Then also YouTube. The Patriot Nurse has her own YouTube channel. She offers a lot of good medical advice, preparedness wise. Also Doom and Bloom, Dr. Bones and Nurse Amy offers a lot of medical training through YouTube. You can go to their website also. They have a lot of medical preparedness news and articles that you can read. Also various forums. Get Off the X has a austere medicine subforum. A lot of great information. The Survival Podcast on their forum. They have a medical portion of their subforum too that you can learn a lot from. Just remember that YouTube videos and reading medical preparedness articles is not a substitute for hands-on training. You need to get down there and get some hands-on training. Now we're going to go to the second portion of the video, which is knowledge that you can get from your home. I'm going to show some basic medical preparedness books that you can buy, even the budget prepper can buy, that you can get a lot of medical knowledge from. Stand by one and we'll go to the second part of the video.